In this video, we are going to show you how to get your lacrosse ball into your obliques. The obliques are these side ab muscles, so to speak. They tip you to the side, they twist you. They have a tendency to tighten up if you are stuck twisted in one direction or the other. And sometimes that needs to be loosened up to balance you out. So you'll take that ball and put it wherever is sore in this area. Go ahead, find a sore spot. You might have to wiggle around for a little bit. You might be able to be straight on your stomach laying down, or you might have to go into more of an oblique sort of angle. Yes, however you do it, you want to make sure you're not stressing and straining up in the shoulder or low back as you're doing it. You might need to prop that knee out to sort of work as a kickstand to help you a little bit. Yep, perfect. And then as you're there, once you find that spot, you're thinking close these ribs down towards hips close. So you're kind of shortening up that distance. Yes, and then lengthening it back out there, shortening on this side. It doesn't need to be huge movements. It's actually almost better if it's just more of a little bit of a rock. Yes, because then you're going to get more stimulation just right underneath there. Other movements that can be helpful or therapeutic in that area are to bring this rib to this hip, backwards and or forwards, and then the opposite. Lovely. If the place that you're finding the tightness in your oblique is a place you can get to laying straight down like so, you can actually add that twist in your upper or lower body. So opening away from the side of the ball, and at the same time sort of thinking to drop that hip down. So you're creating that corkscrew or wringing out the dish rag sort of sensation here. Good. Then you can unwind and recoil. You can also try the other direction or try dropping the hip down and leaving the shoulders square. If all of that is too intense, or if you find that that's too intense, you can try just turning your head. And that may even create enough stretch and change and movement in that fascial chain that you feel that change underneath the ball. If that doesn't change, but again, the big torso movements are too much, you might also try rotating a leg in and out, one and or the other. Good. Any of the movements that feel like they change the tone and tension underneath that ball are fair game for working that lacrosse ball. That means that there's some fascial connectivity there, and it means that those movements are being affected by that tight muscle, and that tight muscle is being affected by those movements. So work away. You can work that spot until it calms down, or if it's not calming down, move to a slightly different spot. That one probably won't release until something else gets released first. And you can spend, well, really you can spend as long as you want to on soft tissue work in a day, but generally I recommend anywhere between 5 to 20 minutes. If you're doing 20 minutes, you should be doing multiple spots. There you have it. Lacrosse balls in your obliques.